Are urine HPV tests reliable for detecting infections? You might be wondering about the reliability of urine tests for detecting human papillomavirus, commonly known as HPV. This virus is a significant cause of cervical cancer and other reproductive cancers. Recently, urine HPV tests have emerged as a non-invasive method for detection. Current research suggests that these urine tests show promising accuracy, especially when compared to traditional cervical samples collected by healthcare professionals. However, they are not yet considered a complete replacement for established screening methods. HPV testing generally involves looking for viral DNA or RNA. The most reliable tests, known as nucleic acid amplification tests, are used for their high sensitivity and specificity. Urine samples can be analyzed using these tests to identify HPV DNA, making it a less invasive and more accessible option for many people. This is particularly beneficial for individuals who may be hesitant or unable to undergo pelvic exams. Systematic reviews and meta-analyses indicate that urine HPV tests have good sensitivity and specificity. However, they are generally slightly less accurate than clinician-collected cervical samples. The accuracy of urine HPV testing can improve with better sample collection techniques and advanced molecular assays. This method is especially advantageous for self-sampling, which can increase participation rates among women who avoid regular cervical screenings. When considering cervical and reproductive cancers, urine HPV testing can be a valuable tool for early detection of high-risk HPV types that are linked to the development of cervical cancer. However, it is important to note that urine tests may have lower sensitivity for detecting some HPV infections or precancerous lesions compared to cervical samples. Therefore, urine HPV tests are currently recommended as a complementary method rather than a standalone diagnostic tool. In terms of testicular cancer, HPV testing is less relevant since HPV primarily affects the epithelial tissues of the cervix, vulva, vagina, anus, and oropharynx, not the testicular tissue. In summary, urine HPV tests are a reliable and promising method for detecting HPV infections related to cervical and reproductive cancers. They offer a non-invasive screening option that can be very useful. However, they should be used alongside established screening protocols and clinical evaluations to ensure accurate diagnosis and appropriate follow-up care. Ongoing research and advancements in technology are likely to enhance their diagnostic performance, potentially expanding their role in cancer prevention strategies. Always consult with a healthcare professional for personalized medical advice.